Well, see, so I'm not gonna lie, I was tempted to go to the Dominican Republic. Why? Because it was cheaper, but I was afraid of dying because I heard too many stories. But I was like, you know what? I'm gonna stick with to American plastic surgery. So I Googled you. I Googled all of your reviews, and then I came in for a consultation. I loved that you were very personable. That's what drew me. I was like, okay, he's going to be the one. But I came here initially because I had a pouch, I had no butt, and I had fat on my sides. So, you walked me step to step on what's going to go for each procedure and the results. So that's the main reason why I came.
We spent a fair amount of time beforehand. I remember talking about it, and there's a lot of thoughts that you have, especially after reading online, about, you see some people's pictures that get posted, especially in the Dominican Republic and other places. And I remember us having a couple of conversations about what's achievable and what the real recoveries are going to be like. And, you were receptive enough to actually listen and understand that this is probably the way it's going to be, and it's not going to be this. I go to the DR, have a vacation, and come back looking like
as if nothing happened. Your results are not going to come overnight. It takes time to form your shape.
Right.
Yeah, I'm flat yeah. I mean, my results are like banging. Like when I'm in my bathing suit, you're like, oh my God! And the best part about it is that you cannot tell that I have plastic surgery because my scar is so below the waistline, and no one can ever tell unless I tell them. But the next thing is that I look very natural looking. I don't look like the DR girls where you could tell like, oh yeah, she had stuff done. My butt isn't as bubblish, and my figure isn't as a Barbie doll shape, as you could say. So I love it that I'm very natural and
Yeah, we spent some time talking. Remember before we talked about, what your features are and how we want to highlight the parts that you liked and maybe enhance the other parts. And I think that was our goal.
I must say, because I had other procedure, I redone my BBL because I was like, oh, I want to go a little bigger. He was like, oh, Dad, are you sure? No, first thing he said, he was like, oh, Dad, it is big enough. I said, no, I want to go a little bigger. I just want a little bit more bump. He was like, okay. The second time I got it done, the recovery was much easier. Maybe because I only got the lipo in the back to transfer to my butt, so it wasn't as much pain and, recovery as when I did my tummy tuck. But the second one, when you get it done, like, in the same spot, I should say, it wasn't as bad as the first time getting the procedure done.
For sure. I mean, after the first one, I think, we were both happy. Well, I was more happy than you were about the size of the butt because again, I always tend towards naturalness.
Right.
You wanted a little bit more volume, which is okay.
Yeah.
I get it. So we took a little bit more fat from your back, and the tummy tuck's the part that adds the most to the discomfort, and that's the not fun part. Second part, I think he kind of cruised through. I remember you coming to the first appointment afterwards, but being like, "That's it."
Yeah.
Nothing more? So you made the recovery a lot simpler, and you followed the steps and not sitting on the...
Absolutely, yeah. You cannot sit on your butt. So do not do that. It will match up your fat.
So we get a special pillow that you sit on so you can still sit. But it's a unique procedure. It hasn't been around forever, but it's become increasingly common.
Absolutely.
And, as you know, a lot of people are having it done.
Oh, yeah. Nicki Minaj, Cardi B, Keep it real, ladies. I had no butt. My butt was like really, really flat. And my back was like really, really full of like Boston. Look at me now. So the reason why I recommend Dr. Rockmore, he's the best. He's very personable. He even gave me his cell phone number. He said, Odette, during recovery, if there's anything, call me middle, day, or night. And that right there touched me. I was like, your cell phone number? I said, are you sure? He said, yes. Even though I didn't need him, but just the thought of you giving me your personal cell phone number to call you, that's what got me right there. So he's the man.
Oh no, you're too kind. You really are.
He's the man.
We had fun together, working together. Yes. I always think that it's not we have to work together on it.
Yeah, absolutely.
And, you know, it's my part sometimes the easier part. You're the one that has to go through the recovery.
I know,
and,
I know.
at the end
But
of the
to know
day,
that you were there for me, like you're not the rest of the time. Okay, just call the nurse. You said no, call me. That's the big difference.
well, thank you. That's really kind. For me, the best part is I get to watch you walk in with a big bounce in your step now, and wearing clothes that you didn't used to wear, which is, you know, there's nothing better than seeing somebody happy. It's contagious.